birth in Fresno if you could?
More midwives.
More midwives.
There's no way to change birth when you're talking about normal birth anyway. In order to support normal birth, you have to have providers that support normal birth. And without that midwifery presence in the hospital and the midwifery model of care present in the hospital, I don't really see a way to change the tide without that. We can educate the consumers till the cows come home. And as a birth network, we have I've been part of that for at least the last decade. It makes a difference, definitely, because parents know what to ask for. At least they know now that they have choices. But it's much more difficult to exercise those choices without having a battle because of the lack of providers that can support that. So to me, that's really what needs to happen. If we're able to get more midwives in the hospital, home, we're fine. We have some excellent home birth midwives. For families that choose home birth, they've got good support. I'm not worried about that. I'm worried about the women that are in the hospital because they're the ones that are getting the major short end of the stick. And sometimes they don't even know it, so ignorance is bliss.
Right.
But sometimes they find out after the fact, and to me, there's nothing worse for a woman than knowing you've been taken advantage of, or that you've been duped, or that vital information was held from you.
Heck yeah. I know about that. And it's called informed consent.
Informed consent is an oxymoron.
Yeah.
It really is when it comes to birth. I've been a nurse for 20 years. If there's anything else wrong with you, if you had to have heart surgery, if you needed your gallbladder out,
Right.
for God's sake, if you needed your bunions operated on, you get informed consent. They explain all the benefits of the proposed procedure. They explain the risks of the procedure. They give you a good idea of what to expect for recuperation. You have a right to choose not to have the procedure. You have a right to say, yeah, these bunions, they do look horrible, and yeah, they do hurt, but you know what? I'm not ready to have my foot chopped up yet. I think I'll just wait it out. And the doctor might tell you, well, Gina, the bunions are only going to get worse. They're going to swell more. They're going to hurt more. When you're ready, you let me know and we'll take care of them. And you have that choice. Nobody's going to give you a bad time about it. Nobody's going to tell you you're a bad person. You're hurting your foot. You clearly want to put your foot in danger. What kind of a foot owner are you?
Your foot's in danger card.
Your foot's in danger card. Your bunion's going to get bigger card. That's what I think about that. Let it be a woman in labor now, and all of a sudden those same articles of informed consent no longer apply for some reason. She doesn't need to know anything about the Pitocin we just hung. I've been a doula for 10 years. I've never heard one. I've been to almost 300 births now. I think I'm at like 298 or 299.
Mm-hmm.
Anyway, I've never heard anyone say, okay, Gina, this is Pitocin. We're giving it to you because of X, Y, and Z. We feel you really need it, and this is why. ABC. Now, by giving you this Pitocin, it might cause EFG. But we're going to monitor you closely. If anything starts to happen, then we would do this or do that. Mm-hmm. And this is what we believe is the best way to help get your baby here. What do you think about that?
You've never heard that?
Never. Ever.
Ever.
I've had clients where I've walked in, like they've been to the hospital maybe before they called me, and I'll arrive as their doula, and I'll see Pitocin hanging, and I'll say, oh, when did they start the pit? Oh, they didn't start any pit, they just gave me an IV. No, do you see the pink label on the bag? Yeah, that's Pitocin. Well, nobody asked me if I wanted that. Nobody asked me if it was okay to hook that up. I mean, I've had clients be angry, and then I feel bad because I told them. They were ignorance is bliss to that point.
Right.
They were just trying to figure out why all of a sudden these contractions had gotten so much more difficult to manage, and they thought they were being a wimpo. That's not informed consent. When someone breaks a bag of waters, all they say is, wow, Gina, we could really speed this up a little. You'd like to be holding your baby by dinner time, right? Okay, well, we're going to break your water. That's going to bring the baby down. They're going to put more pressure on the cervix. That's going to help you have this baby faster. Now, to any woman who's in labor,
It sounds pretty darn good.
getting the baby out faster is a good
Oh,
idea.
faster? Heck yeah, I want to be holding my baby. Bring it. Without any mention of any of the possible risks.
No mention of the cord could prolapse. No mention of now we've, gotten rid of a nice sterile environment for the baby so bacteria can enter. No mention of the baby could get an infection. No mention of your uterus could get infected and it could, cause you a problem. No mention that now all of a sudden the contractions are going to become a lot more intense. No mention of any of that.
Yeah.
Just like, oh, we're going to break your water. Oh, it's nice and clear. Oh, excellent. Okay.
I've heard that from midwives too, just so you know. I don't want it to sound like it's just a...
Oh, no,
yeah. I'm just informed consent across the board means that you're getting all of the information that
Yes.
you need, not just, well, we're going to speed things up. That's not informed consent. And my story about Pitocin, they offered it to me. I said, could it harm my baby? They said, no, everybody gets it. I thought it sounded like potassium, so I was all about it because it's probably good for me. Why would they give me something that wasn't good for me and my baby? That's not informed consent either.
I was having a discussion with some of the obstetricians that I work with, and who, clinics shall remain nameless. But we were having a discussion about their induction rates. And he looked at me and said, Pitocin before the baby's out, Pitocin after the baby's out, what difference does it make? They're all getting Pitocin. And I started laughing and I'm like, really? I go, no, not all births need Pitocin. Yes, they do. Yes, they do. They're all getting it, either before, during, or after.
Oh my God.
And I go, wow. He goes, yeah, babies don't even come out anymore without that. And I started laughing. I go, then I must be and I told him to his face, wow, I must be watching aliens give birth then, because the women I attend rarely have Pitocin.
Wow.
And he told me that was preposterous.
Wow.
And two of the other obstetricians at this point now are laughing, and they're like, well, he doesn't really mean it like that. And he goes, yes, I do.
Oh my goodness.
So they tried to bail him out, and needless to say, he has like an 80% induction rate, and that's what we were having a discussion
So what
about.
percentage of people do you think are getting informed consent when we're talking about birth?
If they're in the hospital and they're not having a C-section, wow. I'm going to be generous. I'm going to say 1% are getting informed
Holy
consent.
crap.
I'm being generous here.
Lisa, you're going to drive me to drink. It's just some depressing
yeah,
stuff.
it's depressing here too.
Oh my God. All right.
If they're getting a cesarean, they're getting informed consent in the effect that it's a surgery, and they're being consented for the surgery. And I've heard those explained numerous times, and it's fairly standard spiel that they're all getting. But that is informed consent for the surgery. When an anesthesiologist is doing an epidural, they give a base informed consent. I don't even I've heard that several times, and I don't feel that that's really informed consent because they don't really talk about all of the things.
So somebody's
that can happen.
not a doula watching this. How can parents go about getting that informed consent? Making sure that they get it.
Well, they have to know what to ask ahead of time. I mean, that's where knowledge really is power. If you don't have any idea about what could happen with different interventions, you're not going to know whether you're being consented appropriately or not.
Right.
But I think if parents just always